Good morning, ladies and gentlemen, or afternoon. This is Dave Kosminski. This is the weekly Town of Portland podcast, and this is episode 3. And with us on the phone, we have Miss Christie Carpino, who is our state rep for Portland and Cromwell, and also on the phone, Mr. Russ Melmed, who is the Chatham Health Director. And in the studio with me is our first Selectwoman, Miss Susan Bransfield. So thank you all for coming and calling in and so forth. I just want to let everybody know that this podcast is being broadcast from our Town Tech Educational podcast studio here live at Portland High School. We are also going to be doing post-production on this podcast. This is going to be episode 3, and it will be aired on the Comcast Channel 15 public access channel Tuesdays at 9 a.m. in the morning and again at 4 p.m. in the afternoon. So we're getting a broad audience listening. As of this morning, we had just south of 800 listens on last week's podcast. So people are interested and the information is getting out there. So without any further ado, hi, Susan. How are you this morning?
Oh, good to be here, Dave. And thank you to you and the Town Technical and School program that does such a nice job with the podcast studio. I'm happy to report some information today, and it's informational, and I hope our listeners find it useful. The Board of Selectmen met this week on Wednesday, and they were reviewing some of the executive orders from the governor's office, and the one in particular that we were reviewing is number 7S, and within that executive order, the towns have the ability to choose from a couple of different programs to help our taxpayers. And the one that the Board of Selectmen chose is called the Low Interest Rate Program, and it will become effective immediately. It was passed unanimously by the Board of Selectmen. And what it means, Dave, is that our taxpayers, in terms of their tax interest, if they're unable to pay their taxes, unable to pay their water and sewer bills, they will be subject to a much lower interest rate rather than 18% interest rate, which is what we have now. For up to 90 days, that interest rate plummets to 3%. So for those folks that are unable to pay their water and sewer bill, which I'll add, the latest bills for this quarter will go out on the 13th of April, those utility payers would have up to 90 days to pay that bill. Should they not be able to pay it, 3% interest would take effect instead of the 18%. We hope that's of some help to our utility customers, as well as those folks that will be getting our bills for taxes, property taxes, on July 1. They, too, will also have 90 days in which to pay that bill, and those bills would be subject to an interest rate of the 3% instead of 18%. Again, we hope that helps somewhat in terms of their ability to pay. For further information, they can call my office and be happy to give them more information. This is something that is brand new and something, again, that we hope will be helpful to folks. Bob Shea, our fire chief and public works director, is on another assignment today. He's not able to be here, and so I wanted to give some updates from him, and they include some updates on the Aragoni Bridge project, as well as some general town government information. In terms of the Aragoni Bridge, as you may have seen if you've crossed the bridge recently, the concrete barriers have been in place by the contractor. The state of Connecticut is reporting that the work on the Aragoni Bridge is continuing as planned. They've completed the milling on the road section that they're working on. The work continues over in Middletown at the St. John's Square intersection. And one note of caution that the town wants to give to everyone that travels through Portland, and that is if you're coming to the light at the intersection of routes 66 and 17A, please, please don't run the light. If the light is yellow, stop. If the light is red, stop. Because we've run into the situation where the traffic is clogging up that intersection, and it really makes things unsafe for emergency vehicles as well as the other drivers that are in that area. So please use caution through there. In the event that this continues, we will be having our police placed there, but sometimes the situation on the bridge, something could happen and it backs up the traffic. So as a rule of thumb, just please don't run that light and we'll all get through there much safer. In terms of public works, you may have seen our sweeper out. They're sweeping the streets. And again, if you could move your car off the street when you hear the sweeper, that'd help. We'll get your street much cleaner and quicker. So that would be helpful to us. Report from our sewer department, please, when you're using your toilets, don't flush wipes, don't flush paper towels, don't flush rags. We've seen an increase in that in our sewer system, and we're hopeful that people will not be doing that going forward. The last update I wanted to give is from our town clerk, Ryan Curley. Before I came up to the podcast studio, he gave me some updates as of today, and today is the 9th of April that we're recording, and Bernie Sanders has withdrawn from the Democratic race for President of the United States. However, he's announced that he is committed to staying on the ballot in all of the states, which means we are obligated to move forward with the primary on June 2nd, 2020. Denise Merrill, our Secretary of State, has called for a cancellation, but the only way that can happen is if the candidates who are recorded as being on the ballot withdraw from the ballot. And those include a Republican candidate for a Republican primary, Rocky De La Fuente. And on the Democratic side, we still would need to have a withdrawal from the ballot of Bernie Sanders and Elizabeth Warren. So as of this date, that has not occurred. The primary will proceed. If the candidates decide to have their names removed from the ballot, they would need to do that by noon of April 27th, 2020. We do want to urge our voters. While it's very important to vote, we also know it's very important to protect our health, and we certainly don't know at this point what June 2nd brings, but at any time, certainly our health is important. Legally, we have to move forward with this primary, but we want to point out that the candidates have pretty much been determined on the Democratic side and on the Republican side. So we urge you to use your careful discretion. And as always, if you have any questions, you can call Ryan Curley at our town clerk's office at 860-342-6743. So those are some of the updates for the town this week, and I turn it back to Dave.
Great. Thank you, Susan. All right. I think there was a lot of information in a short amount of time and so forth. So that's great stuff. Again, I think from, as you mentioned, from our wastewater treatment plant, I think all the wastewater plants throughout the state are running into the same problem with
Yes.
the wipes and the paper towels and the even the wipes that they say are supposedly flushable. We do not recommend that they flush those down. So again, thanks for that update. All right. Now, if we can, would like to turn it over to Mr. Russell Melmed, our Chatham Health Director for the Chatham Health District. And Russ, this is your third appearance on our podcast. This is episode 3. And just an FYI, last week's podcast, we are just south of 800 listens. So it must be your charismatic demeanor on the air, Russ, that all these attractions. So
well, Dave, it's certainly not because I'm always bringing good news to the table. So
anyway, so tell us what's happening in the district.
Sure. So it's just I'll provide the listeners some situational updates as it relates to COVID-19. So far in Chatham Health District, this is not just Portland. Chatham Health District is the local health department for East Haddam, Hampton, Colchester, Hebron, and Marlborough as well. We have 47 confirmed cases of COVID-19 in the district, and of those, 15, as of this morning, are among residents living in Portland. We have roughly twice as many cases in Portland as we do in any other town. Listeners might be wondering why that is, and I think from early on when we started seeing cases in the district, I think I had a conversation with Susan where I said I wouldn't be surprised if we see more cases in Portland, just simply because of its geography. It is closer to southwestern Connecticut, where sort of the epicenter of the outbreak is in Connecticut. It's close economic and social ties to some larger municipalities that border Portland, and its proximity to highway. So I think that those are some of the reasons why we see more cases in Portland, and there's a little bit more population density in parts of Portland. So when you think about how respiratory diseases like COVID-19 spread from people who cough or sneeze and are nearby somebody else, when you have more people living in a smaller area, you're going to see transmission occur more readily. So that's why I think we're seeing more cases in Portland than elsewhere in the district. About 56% of our cases are male, and the average age of those lab-confirmed cases in the district is 58. So this is very consistent with what we're seeing across the state and nationally. We're seeing more men, and for the most part, people firmly in middle age are the positive cases. And at least in part, the age, I believe, is because those are the people who are getting tested. Right now, because testing is still fairly limited, the people who get tested are healthcare workers, the people who are prime working age and being put in situations where they're more likely to be exposed. And there's a priority on testing healthcare workers so that we can determine whether or not they're sick with COVID-19 so that they can get back to work more quickly if they're not. So I think that's why we're seeing that age peak around 50, even though the people at highest risk for severe consequences from the disease are people who are older adults, so people in their 60s, 70s, and 80s. So that's what we're seeing in Chatham Health District. We're also seeing across the state, Chatham Health District is no exception, a number of cases in our nursing facilities. Approximately 40% of all the nursing homes in the state of Connecticut have at least one case of COVID-19 disease. And unfortunately, because of the nature of the population who lives in nursing homes, they're more likely to be frail and have some other underlying health conditions, also more likely to be older. And so around 15% of the patients in nursing homes, when they get COVID-19, are unfortunately dying of their disease. So if anybody's doing the math, it's about it's around 1 in 7. So if you're living in a nursing home and you do get COVID-19 disease, it's a very serious condition. So I think that's why you're hearing about some of the measures that the state is taking to, quote unquote, lock down those facilities. It really eliminated visitation. So if you've got family members in a nursing facility, it's really difficult to get in to visit them unless they're in end-of-life care already. And when people do come to visit, and this includes EMS providers, so ambulance drivers that might be transporting somebody from the hospital to a nursing facility, they are screened at the door before they're allowed to come in. So those visitors, anybody who comes into the facility, including staff, they're actually having their temperatures taken before they're allowed to come in. So I think the state and everybody is trying to limit the amount of cases that we have in nursing facilities any way they can. So those listeners out there who are missing their family members, not able to visit them in the nursing homes, really is for their protection. So I hope everybody can understand that. It's really important.
Absolutely. Sure.
The other update I think that's new from last week is that the CDC has now recommended that just about everybody, when they're going out in public, wear a mask. And I think there's some confusion around the idea of wearing masks. And I want to clear up a few myths. One is that the mask that you're wearing is for your protection, that you can somehow put on a mask, a cloth mask, bandana, and it will protect you from getting respiratory droplets and breathing them in and getting sick. And really, it's the opposite. You wear a mask to protect others from you. The way this works is by preventing, if you cough or sneeze or speak loudly, it prevents those respiratory secretions from leaving your body and getting out into the environment. By the time, if you're a few feet away from somebody and they've coughed or sneezed, the droplets that are heading your way towards your face are so small that they will quite readily get around or through the mask, the cloth mask that you are wearing. So the idea is that if everybody wears masks in public, cloth face masks, that everybody is preventing their own infectious germs if they have disease, even if they don't know it. They're preventing their own germs from getting out into the environment and getting into somebody's eyes, nose, or mouth or onto surfaces. So, really there's no need for people to go and run out and buy medical-grade N95 masks or respirators for a couple of reasons. One, they're really unnecessary because if you haven't been properly fit tested to wear those devices, then they're not really doing you as much good as they would a doctor or nurse who's been tested to fit them. And the other reason is because we want to make sure that we reserve those medical-grade masks for our healthcare providers who are really on the front lines trying to care for people who are sick. And again, because they've been fitted to wear these types of masks, they are really doing them a lot of good in those healthcare settings, and us as regular citizens, not so much good. So the masks that everybody should be considering wearing when they go out in public, if they have to, are cloth. You can sew them if you want. You can take an old T-shirt. You can cut it. There are videos out there. The Surgeon General is out there demonstrating video on YouTube how to make a mask. There are some pretty easy to follow guidelines out there on the CDC's website. So, people can fashion their own mask. It does not have to be anything fancy. Just anything that, covers your mouth. So if you're somebody who has to go to work, who has to go grocery shopping, wear a cloth face mask for the protection of others. Even if you're feeling well, you can still carry the disease and you can still transmit the disease. So if you're going to go out in public, if you're going to go to work around other people, wear a face mask. But again, it doesn't have to be medical variety. And care for that mask. Wash it in regular detergent and dry it, and that should be enough. So if you're sick and you've got germs on your mask, just washing it normally should be fine to take care of that. So I think I was out yesterday, and I did see a lot of people wearing masks. Not as many as I would like, but I think it takes some time for everybody to get used to the idea of putting something over their face. But really, I think if everybody wears masks, we are all protecting each other in that way. And that's how we're going to help get through this.
Sure. Thanks, Russ. I appreciate it. Is there a recommendation for frequency of washing the mask? Daily, weekly, every couple of days? Is there a recommendation?
Yeah, I would think daily, really. Think about wearing something over your mouth and nose for 6, 7, 8 hours during the day. It's going to get damp. It's going to get dirty. You're going to get your respiratory secretions all over that mask.
Sure.
So wearing it over and over, A, is not going to, pretty soon it's going to be pretty unpleasant for you to put that back on. And two, you're going to be, the effectiveness of the mask is going to be lowered as it gets damp. And so you do want to care for it properly every day. So, making sure that maybe you've got a couple of masks. Take out a couple of old T-shirts, cut them to size, strap them to your face any way you can. Again, there's guidelines out there for how to make them, and just have a rotation. So you should be caring for the mask. Routine washing is the way to do it.
Great. Russ, is there a recommendation for? You see a lot of people wearing gloves. The surgical gloves. Is there a recommendation for that, or is that a good thing?
No, the use the way COVID-19 is transmitted is not through the skin. But if you touch a surface that has viral particles on it, and then you touch your eyes, nose, or mouth, you can get infected. So gloves are just a nice reminder to not touch your face. So if you're wearing bright purple nitrile gloves on your hands, and you bring your hand up to touch your face because you have an itch or whatever, you're going to be very quickly and readily reminded, oh, wait, I shouldn't be touching my face. Mm-hmm. But there is nothing magical about the glove itself. You're just going to remember, oh, I shouldn't eat this sandwich with my gloves on. I should take my gloves off, wash my hands, then eat my sandwich.
Sure.
So the gloves, there's no recommendation for everybody to be wearing gloves unless you are in a workplace where you are, for example, working in a grocery store and you're stocking shelves and you're at a checkout. For those people, not for the general public, but in workplaces where you're engaging in frequent touching of other high-touch surfaces, then that is something that is recommended in those settings for those particular employees, but not for the general public out in the community. Wearing gloves, again, it's a nice reminder not to touch your face, but not necessarily something everybody needs to be doing all the time.
Sure. Great. Thanks, Russ. And just a word on your staff. I think, like everybody here in the town hall, our offices are closed to the public, but what's the situational awareness with your staff out there?
Yeah, so we're still, we are closed to the public. Our main office in East Hampton, is closed to the public, and because our environmental health staff that provide a lot of the services to the public operate principally out of offices in each town hall, and that's how it works in Portland. We're doing everything by mail and by appointment. So you can get all the applications that you need off our website, chathamhealth.org, and print up those applications, fill them out, send them in by mail. If you need to make an appointment, you can call our sanitarians in their town hall offices or email them and make an appointment. We are still doing field inspections, but what we're asking people, our customers, to do is please to limit the number of people on site when we're doing inspections. So if we're going to go out and inspect a septic system that's being repaired, we don't need a lot of people there. We just need our sanitarian and perhaps just the installers themselves.
Sure.
We preferred if the property owner wasn't there, if the property owner's kids weren't there, if there are other contractors doing work at the site, that they not be present. So, just the minimal number of people who have to be there to get the inspection done. Really, it should be just our inspector and one other person at the most. And
Great.
we're also asking people to wear masks themselves. So when our inspectors go out to a site to do work, we're hoping to see maybe one person there, and that one person should be wearing a mask. And that person should be standing at least 6 feet away from our sanitarian at all times. So we're still operating. We're still doing our inspections and taking in applications and doing reviews and that kind of stuff. But we are doing it with the least amount of people on site as possible and following all the safe social distancing practices. Keep everybody safe.
Great, Russ. Hey, thanks for the update. Also, I will, as we finish up the post-production on this podcast, I will get the link to Tina or Nancy out at your office. Maybe you could put the link on your website as well.
Sure, of course.
That'd be great. So, thanks, Russ. I appreciate it as always. Thanks for your time and your diligence on addressing this pandemic occurrence that we have in the nation.
Sure.
So anyway, all right. With us again on the phone, we have our state representative, Ms. Christie Carpino. Hi, Christie. How are you?
I'm well, Dave. How are you?
We're keeping pedaling. That's all we can do as far as that goes. So tell us what's happening on a state level. I know you're not in session right now, so just tell us the status of what's going on, and if you have any insight into the governor's crystal ball, lay it on us.
Well, thanks for the questions, Dave. I will dispel any myths. I have no crystal ball. If I did, I would have let you guys know a long time ago. I will tell you that things at the Capitol are far different than anything I've seen, and I think everybody on the outside world has appreciated that to some extent. So legislative hearings and committee meetings and full session voting dates have been suspended. The date has changed for that period of time a few times recently. Yesterday, they just announced again that we would extend our physical closure till April 23rd. But I want everybody listening to know that is merely a physical closure. I am fortunate enough to have the ability to be talking to many of our constituents on the phone, via email, and continuing to communicate with them. So I don't want anyone out there to think just because the building is closed in today's day and age, it's merely a building. So to please reach out. I know that I will speak for all of my colleagues in Hartford. We're all operating the same way. We're operating from home, but we are still out there helping our constituents. Folks, I encourage them all to reach out. The executive orders, as everybody knows, have been from the governor's office, and Governor Lamont announces them and sets them out for public to read, and they're not always as clear maybe as they can be, and that's through nobody's fault. This is something that everybody in Hartford has been working together on, trying to do what's best for the state. So I do want to encourage those that might have questions and haven't yet reached out to please reach out to me if I can help. I'll give you some of these links if you don't mind when you're done, but I do want to just make sure that 860-240-8700 is my office number, and I'm still there to help anybody that needs some assistance or guidance. The other thing I want to announce, though, is we're all working together to make sure, and Susan and Russell and Dave, you guys are part of this team. I think we're all working together to make sure that everybody has the most current information so everybody can make the best decisions for their family, for their health, for their businesses. And information continues to change. The executive orders sometimes are narrower than the previous ones. They add additional provisions as we all struggle with the same enemy, this virus. So I just want folks to know that if they hear new information, to make sure that they understand and to reach out to any of us for assistance. I want to make sure that folks have the most up-to-date information available to them. Is one instance, Access Health recently has opened up their enrollment for folks who don't have health insurance. And those are the types of bits of information that I'm continuing to get out on my state page that often come out of the executive branch as well. And I think that's very important for folks to just not overwhelm themselves or panic, to stay informed so that everybody can take the information and make the best decisions for themselves. And unfortunately, there are folks out there taking advantage of the virus and some of the unfortunate and difficult situations out there. So I do want to make folks aware that scams are starting to pop up, and I don't want to see anybody taking advantage of. Some of the government sites themselves have started mentioning them. So just want to encourage everybody to think twice. If they think something's suspicious, to reach out. If it's something they think I can help them with, please do. I don't want to see anyone suffering any additional difficulties because of an unscrupulous scammer out there.
Absolutely.
And then I want to close with a positive, if I could. I just want to thank everybody who's out there. Our non-essentials, our first responders, our healthcare workers are tremendous. And in addition, I think we have a lot of unsung heroes out there, and I think they all know who they are, and those of us on the phone know many. But I think it is really rewarding and uplifting to, as we're going about our days, and some of them I think are tough, and everybody recognizes that we're hearing about neighbors helping neighbors, about kids home from school doing, going out of their way to help.
Sure.
Family checking on, individuals that they might not have chatted with. And I just want to make sure that the folks out there doing the right thing, going out, are really what's best in our community. So
Sure.
I do want to add that it's what makes Portland what it is. And I do hope that those folks out there doing those things when they think no one's looking know that they're appreciated.
Acts of kindness, absolutely. Yeah. And we've been stressing on it every one of our episodes so far. And if you have a neighbor that's an elderly neighbor, reach out, pick up the phone. Hey, how you doing? Okay. Can we do anything for you? Because, again, that not only makes, our community such a close-knit community, but Portland and Cromwell are, like I say, right across the river from one another. And we're fortunate to have you as our representative from that standpoint. From the legislative session, is there any insight? Are they going to be extending the session? Are they going to be calling a special session? What's your sense there?
My crystal ball is cloudy. There's a lot of things that still need to be done. I mean, obviously there's important work to be done. We don't know yet. I truly believe that the answer is going to be determined on the outcome of this virus and how we do. Public health comes first.
Right.
The public health of our residents, the public health of everybody in that building. We hold ourselves to the same standards.
Sure.
If we shouldn't be in groups of any more than 5.
Absolutely.
We certainly don't want a few hundred folks in the building. The rules apply to all of us.
Sure.
The governor, we can always have a special session. It wouldn't be foreign to have a special session after the traditional end date, whether it's for something like a pandemic or just because of special circumstances. But in truth, I think it's all going to be determined by how successful we are with flattening the curve.
Sure.
I will tell you that although we are not in session, there's still a lot of work getting done. I think the difference now is where we've spent many hours on many things. I think right now we're all focused on the same thing, and it's helping our communities get past this virus and
Right.
stay safe and make sure our communities are doing the best that they can with the resources we have. So legislation is probably, in all fairness, secondary to us right now. Right now, it's the public health of our residents.
Sure, as well it should be. Well, like Dr. Fauci says, as we can't determine the schedule, the virus is going to determine the schedule. So we just got to go from there and appreciate it. So again, Christie, thanks so much for all that you do for both Portland and Cromwell, and it's great to hear your voice on the phone. And stay safe with you and your family. And we're going to turn it back over to Susan. And I think Susan, we just got a couple of things. Different from last time. We now have the transfer station bulky waste scale open. So I don't know if you
Yep,
can tell.
that's for sure. It'll be open on Saturday of the Easter weekend, and then Tuesday through Saturday the following week. And having the scale open, we've put in some measures that I think make it much safer for our customers and certainly much safer for our workers as well. So please adhere to the social distancing and make sure that when you do pay, that you do not go beyond the area that is designated. We want everybody to get the service that they need to have accomplished, and we want everybody to remain safe. I also just wanted to add that this is a very holy time in many of the religions that people celebrate, and I want to wish our listeners a happy Passover, certainly a happy Easter, and Ramadan is coming up later this month. In the midst of this pandemic, it's important to remember those loved ones and friends that we know who may be suffering from illness, and also those that have passed. Some of my very dearest friends and people that I admire recently have passed away due to COVID-19. And maybe just a moment of silence to say thank you for all the things that they've done in our lives. Dave, as a community, we've pulled together, we continue to work together, and as Christie pointed out a few minutes ago, there are so many wonderful people that have reached out to help their neighbors and also have contacted my office and given of themselves as well as given monetary donations. So if you, our listener, are in need of some assistance or even some clarification of some of these things that are happening, please call my office or reach out to Christie Carpino. We work together on a daily basis, and we can certainly help you and make sure that you get to the right place. So thank you, Dave, for what you do. You keep our communications very open and transparent, and we appreciate that. And I also, on our daily calls, want to thank Russ Melmed, our Director of Public Health. You've been fabulous and certainly a strong support to making sure that we all stay as healthy as possible in the Chatham Health District, of which Portland is a member.
Thank you. Russ, you're still there. Thank you so much for calling in. And again, Christie, thank you for all that you do. And I think that's about wrapping it up for our episode 3. And again, we just want to remind all of our listeners that this episode will be aired on the Comcast channel 15, on Tuesday at 9 a.m. in the morning and at 4 p.m. in the afternoon. So for those of you who don't have internet access but have a TV, you can certainly listen to this broadcast on the Channel 15 public access channel. So on behalf of us, all of us here at the Town Tech Podcast Studio at Portland High School, this is Dave Kosminski, your host, and I think we're going to do this again next week, Susan.
Yes, I think it's very helpful. Thank
Okay.
you, Dave.
And again, Christie, thank you, and if you're still there, and Russ, thank you.
No problem, Dave. Happy to be here.
All right, everybody be safe, stay home, and stay well. So we'll see you next week. Thank you very much.
Just wash your hands. Don't touch your eyes, your nose, your mouth. Social distance, avoid the crowds. Fight against the corona. Practice good hygiene and keep your personal space clean. Respect the social distancing. Fight against the corona. You're not an Asian, black or white. The corona is colorblind. Together we can win the fight. Fight against the corona, corona. Stay ready today, and tomorrow will be okay. Together we can win the fight. Fight against the corona, corona.